Therapy can help children manage their anxiety through a variety of methods. Two of the most common methods are cognitive behavioral therapy and exposure with response prevention. So with those, the child as well as the parents are usually involved in the treatment. Individually, the child can learn different skills to manage their anxiety. So they may learn relaxation skills, coping skills, problem-solving skills. They also need to learn an emotional language in order to communicate about how they're feeling. Once they learn those things, they can then learn how to understand their anxious thoughts, how to restructure those thoughts to have a more realistic view of their circumstances. And then as they get better with those things, they are able to more gradually face those fears. The parents are vital to this whole experience as well. They need to understand how their child feels their anxiety, how they express it, how it manifests in their day-to-day lives. So a lot of the assistance with the parents is teaching them about it, helping empower them to allow their child to face their fears, giving them some information about how to reduce the excessive reassurance seeking, which I spoke about already. And then one of the other really important components to working with the parents is helping them stop over-accommodating their child. That is basically where the parent will, in their own distress for their child, try to prevent the child from having any sort of anxiety. But by doing so, they're actually reinforcing avoidance behavior. So they're allowing their child to escape what they don't want to be around, and then that ends up making the child feel temporary relief, but they're still not engaging in the activity that may need to be going to. So we want to help parents understand that it's better to help the child face the fear and feel more comfortable with it rather than just allowing them to continue avoiding it. Another option is group therapy for children with anxiety. This is especially helpful for kids who have social anxiety because then they can learn the skills around other kids who also feel uncomfortable, but then they can also learn some interpersonal skills that will help them feel more comfortable interacting with kids at school and with activities that they go to on a day-to-day basis. And it seems like it helps them feel less alone in their problems, and that usually helps promote growth.